Straight from Attorney Reddington's mouth.
You didn't recommend that she have a hospital evaluation, did you? This is the day before she killed the kids, right?
The 23rd?
Yeah.
It was the day before.
You didn't recommend a hospital evaluation, did you?
No, there were no,
The answer is no?
no.
Lindsay Clancy's attorney, Kevin Reddington, did not say the day before she allegedly killed the kids, the day before she supposedly took the kids' lives. He knows. He has never denied that his client, Lindsay Clancy, took the lives of Cora, Callan, and Dawson on January 24th, 2023. Now let's talk about the rest of the Day 10 recap. Today started with cross-examination of Dr. Jennifer Tufts, who was Lindsay Clancy's psychiatrist from September 2022 through January 2023. That cross-examination started with Reddington asking about her experience and education. Tufts finished her psychiatric residency in July 2022, and she began practicing independently in August of 2022. Her first appointment with Lindsay was September 15th, about 1 month later. Tufts testified that during her residency, she had treated around 50 patients with postpartum depression and no patients with postpartum psychosis. She said that her practice listed perinatal psychiatry as a special interest, but she did not call herself an expert. All of her appointments with Lindsay were through telehealth, and I'm going to go through and summarize each of those appointments and the medications that she put Lindsay on or took her off of. September 15th, 2022, that first appointment, Lindsay saw Tufts for postpartum anxiety. Tufts prescribed Zoloft starting at 25 milligrams with instructions to increase it up to 50 milligrams. Lindsay was hesitant to take it, and she actually waited a few weeks to start that medication. On October 20th, Lindsay told Tufts that she had began starting that Zoloft about a week before that appointment on October 20th, and she had increased up to the 50 milligrams the night before. She reported that she felt awful. She was having more trouble sleeping and eating, increased anxiety and depression, and she told Tufts that she had spent the entire previous day crying, which was not normal for her. Tufts ultimately told her that she could stop taking the Zoloft. During this period, Ativan, Buspar, and hydroxyzine were also discussed or prescribed for anxiety and sleep. Tufts testified that Lindsay was extremely hesitant about medications and she was very afraid of side effects. At one point, Lindsay said that she did not want to be alone. Okay, next appointment was November 2nd. Lindsay remained hesitant about Buspar because she was afraid of medications. Tufts asked about any thoughts of harming herself, which Lindsay denied any thoughts or plans of harming herself, but there was some discussion about Lindsay being afraid that she could eventually start having those thoughts. During this period, Lindsay was also seeking help other places. Reddington established that Tufts did not obtain Lindsay's records from her November emergency room visit. Tufts also did not obtain records from Women and Infants Hospital later in her treatment, but she did get a 2-page discharge summary from McLean Hospital, but she didn't request Lindsay's complete McLean records. Tufts also did not instruct Lindsay to keep a medication or side effect diary. Tufts was also asked if she knew that Lindsay had contacted a crisis hotline twice. She said that she did not know that, and learning that was surprising to her. December 1st, Tufts saw Lindsay again, and she said that Lindsay once again denied having any thoughts or plans of self-harm, but Lindsay reported that she was close to feeling that way, and she was afraid that she was heading in that direction. Later on in December, Lindsay reported intrusive thoughts, hopelessness, worsening sleep, and feeling like nothing mattered or like she was going to die. Tufts testified that when she asked Lindsay if she had an actual plan to harm herself, Lindsay denied it. She also never reported any thoughts of harming anyone else to Tufts. December 16th, she saw Lindsay again, and Lindsay reported that she was having a very difficult time. Her mood was depressed, and her affect was described as flat. And then we moved into January 2023. After Lindsay's inpatient stay at McLean Hospital, Tufts continued treating her. On January 9th, Tufts prescribed diazepam, which is also known as Valium, for continued sleep problems. On January 12th, trazodone was increased to 150 milligrams for sleep issues. January 16th, Lindsay told Tufts that her mood was very low, she had to force herself out of bed, and that bonding with Callan felt forced. Tufts prescribed amitriptyline, which is another antidepressant. And then January 23rd, the day before Cora, Dawson, and Callan had their lives taken, Lindsay told Tufts that she was depressed. She had very little motivation. She felt numb, and she had gone days without really feeling emotion. Tufts increased the amitriptyline. Reddington directly asked Tufts whether increasing that medication pushed Lindsay over the edge. Tufts said, "I don't think so." Throughout all of these appointments, Tufts testified that she never observed Lindsay to be psychotic or manic. She described Lindsay as organized and able to communicate and advocate for herself. Lindsay repeatedly denied having any intent to harm herself or anyone else when this was assessed. Tufts testified that if she believed Lindsay posed an immediate danger to herself or anyone else, she could have sought an involuntary psychiatric hospitalization, but she never believed that that threshold had been met. Tufts also testified that she repeatedly recommended weekly individual therapy. Lindsay attended therapy twice in Tufts' practice in the period that Tufts was treating her. We then heard from Julie Paul, who is a psychiatric nurse practitioner, and this is the person that Lindsay's mother-in-law, Sue Clancy, referred her to. Paul founded South Shore Hospital's perinatal behavioral health program in 2018. She explained that her role primarily involved assessment, diagnosis, and medication management rather than ongoing therapy. Paul first spoke with Lindsay on November 20th, 2022, after she was referred by her mother-in-law. Lindsay told her that she had actually done well during roughly the first 12 weeks after Callan was born, but her anxiety increased after Patrick returned to work. She described feeling overwhelmed, having racing thoughts, difficulty leaving the baby, and severe problems sleeping. On November 21st, Lindsay had her intake at the practice that Paul was the director of. They did an Edinburgh postpartum screening, and her score was 23 out of 30, which sounds severe, but she answered no to the self-harm question. Her anxiety score on a different screening, though, was 21 out of 21. That was a generalized anxiety disorder screening. Paul testified that Lindsay denied having any thoughts about harming herself or anyone else. She had no hallucinations or any signs of delusions. She described Lindsay as goal-directed, linear, a good historian, and an active participant in planning her care. Paul prescribed Prozac at 10 milligrams with a plan to increase it to 20 milligrams if Lindsay tolerated it well. Lindsay had previously taken Prozac successfully in college when she was having some anxiety about public speaking. Paul also encouraged Lindsay to temporarily use Ativan for sleep while she was waiting for the Prozac to take effect. The longer-term goal was transitioning away from Ativan and towards Buspar, but within days, Lindsay contacted Paul through MyChart. On November 25th, after only taking Prozac for 3 days, Lindsay said that she felt disconnected, out of it, and spacey. Paul told her to stop the Prozac. Her medication plan then changed again. She was prescribed Remeron, and Klonopin was added as needed. Paul testified that she told Lindsay to stop Prozac, Ativan, and Benadryl and instead take that Remeron and Klonopin. On November 27th, Lindsay reported that she had slept and felt rested, but she felt super disconnected with myself and reality. She believed that the Klonopin may be causing that, and she wanted to stop taking it. So Paul told her to stop it and that it may help with the disorientation. On November 28th, Lindsay reported having a panic attack. Paul recommended that she go for a run because exercise had helped her before, and she also recommended considering a partial hospitalization program, but Lindsay did not believe that it would work logistically with her family life at the time. Paul was leaving the practice at the time, and so on November 30th, she transferred Lindsay's care to nurse practitioner Rebecca Gelada. Paul testified that she had no further contact with Lindsay after that. So that's the recap on day 10. Let me know your thoughts on that video clip I played. They'll be back in court tomorrow. I'll be back with another recap after that. And most importantly, rest in peace to the 3 children that are no longer here. The 3 children that should be the focus of this case. Not conspiracies, not delusions, not the defendant, not Patrick Clancy. The focus should be Callan, Dawson, and Cora. Rest in peace to these children.